Hello everyone, my name is Dr. Vikas. I'm the Director and Head of Pediatric Hematology, Oncology and Bone Marrow Transplant Division at Fortis Memorial Research Institute, Gurgaon, India. As we all know it very well that sickle cell anemia is a genetic problem and it's a major concern in some of the countries in Africa, namely Nigeria, Uganda, Ghana, Tanzania, Kenya, Cameroon, Congo and some other parts of Africa. So we're going to talk about transplants. What bone marrow transplant is. So you can call it bone marrow transplant, you can call it stem cell transplant. It is one and the same thing. There are two types of transplants. One is autologous transplant and the second one is allogenic transplant. So there is no role of autologous transplant in sickle cell anemia. The reason being, in autologous transplant, you take out the stem cells from the patient itself. There are specific indications of doing an autologous transplant, namely multiple myeloma, certain solid tumors like neuroblastoma, high-risk medulloblastoma and lymphomas. But what we need to know today is allogenic transplants, and it is of three different types. One is matched sibling donor transplant, second one is unrelated donor transplant, whether you take the stem cells from an unrelated adult donor or you take the stem cells from a cord blood, unrelated cord blood transplant. And the third one is a half match transplant or a haploid identical transplant. The first thing what the patient and the doctor needs to know is to do a test called Hla typing of the patient and siblings. There is a 25 to 30% chance that the patient and sibling are fully matching to each other. Having said that, let's say 100 patients are there and they need bone marrow transplant and they have got siblings. So 25 to 30 would be lucky enough to have full match donor from their siblings, and trust me, that is the best transplant for a patient who has got sickle cell anemia with the cure rates close to 95 to 98%. But if somebody doesn't have a full match donor in the family, you can do an unrelated donor search. There are national and international registries from where you can get a donor. The biggest registry in the world is NMDP, which is in US, that's National Marrow Donor Program. The second biggest one is in Germany, DKMS, and like that we have a registry in India by the name of Datri, and there are quite a number of more registries which are there in different parts of the world. But people of African origin, it may be difficult to get an unrelated donor because of the underrepresentation of people of same ethnic origin. Now what is the option left? The option left is a half match transplant, which is haploidentical transplant. You can take stem cells from the parents. So 50% of our genes comes from father and 50% of genes comes from mother. So father and mother are at least 50% matching with the patient. As I said that with the full match donor transplant, the success rate is 95 to 98%, but with more and more expertise coming up in haploidentical transplants, the success rate with the haploidentical transplant is also 85 to 90%. The patient who comes to India stays in the hospital for 3 to 4 weeks and in India for around 3 months, that is around 100 days post-transplant. Then the patient goes back to the home country and does some tests initially on weekly basis and then fortnightly, and keeps on sending us those reports and is in contact with the local doctor. So friends, that is in a nutshell what you all need to know about bone marrow transplant, and trust me, there is no risk to the donor. The donor is safe, nothing is going to happen to the donor. The donor gets some injections under the skin, which is for 5 days, which is going to mobilize the stem cells from the bone marrow to the blood, and you can easily collect the stem cells from the blood in a blood bank. And we, sitting in Fortis Memorial Research Institute, Gurgaon, have got a state-of-art transplant unit. We do more than 150 transplants in a year, which means more than 15 to 18 transplants in a month what we are doing, and there are quite a number of families who have shown interest and who have shown trust in us from different parts of Africa and are doing well. So it is not just sickle cell. The other indications for bone marrow transplant include relapsed malignancies like leukemias, aplastic anemias, thalassemias, inherited bone marrow failure syndromes, and immunodeficiencies, metabolic disorders. So if you or your loved one is having any issues related to this, please feel free to contact us. And earlier is always better. If you have a patient who is 1 year of age and needs a transplant, please don't delay. Try to come to us at the soonest so that we can achieve good outcomes. But that doesn't mean that a patient who is of adolescent age or of adult age cannot undergo a transplant. But earlier the better, sooner the better. Thank you very much.